So good afternoon, everyone. It's so great to be with you all this afternoon. Thank you all for joining. I'm so excited about our session today. My name is Stacy Stewart. I'm president and CEO of March of Dimes. And also I want to just let you know that you are now in the 7th episode of Healthy Moms, Strong Babies. This is a webinar series that we've been bringing to you all every week for the past 7 weeks or so, really focusing on so many of your questions as a result of so many things going on with the COVID-19 pandemic, how it's affecting moms, how it's affecting pregnant women and pregnancy. And so we want to make sure that this session today is very helpful to all of you all that have a lot of questions about especially planning for a family, about birth spacing, about planning for a healthy pregnancy. And we have some great guests that are joining us today. I want to say, first off, thank you to Merck for a generous contribution, allowing us to bring you these webinars over the next coming weeks. We're very grateful to the support of Merck through its Merck for Mothers initiative. So thank you so much, Merck. Today is really a very important subject. It's one of those subjects that's been coming up to a lot of us time and time again. Is this the right time for me to be having a baby? And if I need to be planning my family or thinking about family planning right now, how should I be thinking about that in the midst of a pandemic with all of the health risks that could come along with it? So we're going to really get into some really important questions. You know, planning for a pregnancy is always really important. It's important whether we're in great times without a pandemic. It's certainly even more important now. It's really important if this is your first pregnancy, but it's also really important if you're in between childbirth and your next pregnancy, what we would call birth spacing, and allowing your body enough time to make sure that you can have a healthy baby the next time. Those are things that are really important because making sure that your body has had enough time to recover, that there's enough time between one birth of a baby and the next pregnancy is often associated with reducing health risks to the baby and improving birth outcomes. So all of these issues, again, whether or not this is your first pregnancy, you were thinking about becoming pregnant when the pandemic hit and now you're wondering what to do, this is the webinar that's hopefully going to address some of those issues. This is really an important time because there's so many questions that are coming up around, well, if I do get pregnant, will I be able to make my prenatal visits? What will it be like in the hospital when I'm ready to deliver my baby? And will it be safe for me and my baby once the baby is on its way? And if the baby already has, will have siblings, you know, what risk will exist for those siblings if the baby comes and is in the house and has come from the hospital, or what risk may the baby face if there are others in the house, and especially siblings, and what's the risk of infection and what's the risk to overall health for all of us. So again, we're going to get into a lot of these kinds of questions. One of the things that we do know, though, and even though we're going to be answering hopefully a lot of questions, is there are a lot of questions that simply just we don't have all the answers for. While we are finding out more and more every single day about how COVID-19 impacts pregnant women, there are a lot of things that we don't know. For example, we're not exactly sure. We don't have definitive information right now about whether or not the virus can actually be spread through vertical transmission from the mother to the fetus. There is information that suggests maybe not, but then it's also not totally conclusive. We also know that there have been a very small number of babies who contracted COVID-19, but it does seem as though possibly that virus was contracted after childbirth through person-to-person contact. We also don't know about the impact of COVID-19 on birth defect outcomes. And of course, a lot of us have been seeing in the news this new variant that's actually creating a lot of challenges for children, and it seems to be associated with COVID-19. And of course, these are things that I know moms are thinking about with respect to whether or not it's a good time to be thinking about getting pregnant and eventually having a baby. You know, we go to some very reliable sources to get a lot of these questions, and even they are not exactly clear on some of these things. For example, ACOG, which is the American College of Obstetricians and Gynecologists, has said there's really no clear answer about whether or not today that they really recommend whether or not there should be any delay in attempting pregnancy. The CDC has also not made any formal recommendation on what they would advise women to do at this point. But there are women that are saying, I really do want to prevent pregnancy. I don't want to become pregnant right now. So what are the things that I should be doing right now? There are public health experts that are recommending avoiding unnecessary medical visits. So if that includes prenatal visits and things like that, it certainly is something that women are thinking about as they think about maybe avoiding pregnancy at this time. We have heard a lot about hospitals limiting visitors in the hospital. So when you're ready to give birth to the child, there may be limitations in terms of who can be in labor and delivery with you. So again, there are just so many questions. There are a lot of couples that are quarantining together who are also thinking, hey, this might be a good time to have a baby since we're together all the time, which is probably a logical way to think. But again, this is one way to be thinking. We just want to make sure today is just giving you a lot of information about what to be thinking about. And then the last thing I'll just say is that a lot of women were either in the process of fertility treatments or are wondering because they know that they will need fertility treatments when they'll be able to start that, because a lot of that practice had stopped for a period of time. Some are in the process maybe of opening up depending on where you live, or maybe haven't opened up. And so a lot of women are wondering what's the timing on that as well. So if you're not sure what to do, how to think about contraception, fertility, birth spacing, pregnancy, all those things, this is the webinar hopefully that will give you a lot of information. And I'm really glad that we have so many wonderful panelists here joining us to answer these questions, and great experts. And I'm going to introduce them now. The first is Dr. Jessica Shepard. Dr. Shepard is an OBGYN. She's also a women's health expert in minimally invasive gynecology. She's founder of Her Viewpoint, and I'm sure she'll tell us more about that, but it's an online women's forum. And Dr. Shepard, we're so glad that you joined us today. The next guest is Kimberly Harper. Kimberly is a master's prepared nurse who's a perinatal neonatal outreach coordinator at University of North Carolina's Center for Maternal and Infant Health. She's also a member of the 4th Trimester Project, which I know she'll tell us more about that as well. Kimberly, thanks for joining us as well. Kelsey Nixon is a host, an author, an advocate, and she's a March of Dimes advocate as well. We're so grateful to Kelsey, and Kelsey has an amazing story that I know she'll share with us about her own pregnancy journey. And certainly last but not least, Tanya Lewis-Lee is producer, author, founder, goes on and on and on, but the founder of Movida Organics. She's an incredible women's and infants health advocate and has been in this work for many, many years. She's also a member of the Board of Trustees of the March of Dimes. So I just want to say thank you to all of our guests for joining, and we're going to get right into it. I'm obviously going to introduce and start some questioning with each one of our panelists, and then we'll open it up to questions. I just want to remind you, we are on Facebook. We are monitoring questions. Even as we speak, if you want to chat questions or put questions into the box, I can see them, and I'm happy to elevate and make sure those questions get raised to the panelists so that they can answer them in real time. So don't hesitate to ask questions as we go. So first, I'm going to start with Dr. Shepard, I may flip between Jessica and Dr. Shepard. Hope you don't mind.
Not at all.
First name basis. But you have such great insight into contraception, fertility, and birth spacing, obviously, as an OBGYN. What are your views right now about how do you tell women whether or not it's safe to get pregnant now? And what are the risks to women if they are interested in conceiving right now during the COVID-19 pandemic?
That's a great question. And I'm glad that you said earlier that there's a lot that we don't know. And I think that's still where we lie. There's a lot that we don't know. But as we start to reveal information and look at retrospectively what has happened in the past, we are coming up with new guidelines. They change every day. And so one of the things that's important about this entire pandemic is the emotional and mental aspect of how this is affecting everybody. And so when that comes to childbearing, the last thing as OBGYN I would want to say is you don't get pregnant, right? And so I want to still encourage everyone who is looking at conception and pregnancy in the near future to still weigh their options and really talk to their partner, or if they're single, is this a good time for me personally that I would want to go through a pregnancy? So those are the intentional conversations that women and their partners need to have with an OBGYN to figure out, is there something medically that might, affect their pregnancy differently because we're in this pandemic? Because we do have again, studies that show that now we're seeing, like you said, in young children, something very similar to Kawasaki disease, which again is a vascular disease. And even, ACOG, which is the American Congress and College of Obstetrics and Gynecologists, recently came out with a new recommendation for women who are at 30 weeks or even at 34 weeks if they have severe preeclampsia to deliver them much more earlier than we've seen ever in recommendations in the past, because we are finding that because of COVID, it's affecting more of a vascular part of the pregnancy than we ever thought before. So those are some of the things that are coming up. Does it necessarily mean that people should not get pregnant? Absolutely not. But what I would do is, again, enter with caution, make sure you have intentional conversations, but we want people to understand that although this is taking an emotional aspect, that we still want you to carry on with the things that may have you've done before, pre-COVID, as I like to call it. Now, looking from a fertility aspect, we have gotten back to the point where, infertility doctors are still doing their procedures as they did before. There was a gap where we weren't operating, we weren't doing some of these procedures for infertility aspect, and they are restarting that as well. So again, we're trying to regain some of that normal routine that we had in the past, but having thoughtful and intentional conversations is really where I would encourage women and their partners to do as we go forward with pregnancy.
How are OBGYNs adjusting now to prenatal visits? I mean, what are you telling your patients about keeping up with their prenatal visits, and what's it like in the office? Is it safe to come in the office for prenatal visits? Are you doing telehealth? Like, what is
It's
all
very quiet in the office now. And
And
reason
very
being,
clean too, even cleaner
yes,
than normal, right?
I have never seen such a waiting room with lack of people in there. And the reason really is, at the end of the day, we're still in that time frame where we want to keep everyone safe, again, because of a lot of unknowns, and because we do know how that transmission occurs, which is respiratory droplets and on hard surfaces. We try to minimize that with the amount of people that we have in the office. So we use telehealth, which I think is an amazing feature of medicine and technology and innovation, to allow us to still have prenatal visits, and we gap them differently. And what we are doing is, when people come in, we're still recommending not bringing in their partner, again, to decrease the amount of people that are around and decreasing that transmission. But again, we are still having people come in for their prenatal visits, just in a different time frame, and just, again, without maybe that support that they usually bring to the visits. But we're still doing ultrasounds, labor, when people go in for labor or for triage. We're making sure that everyone is masked, both healthcare workers and healthcare providers, and the patients as well. And when we have people, we usually, actually, a lot of hospitals are doing a much better job at testing. Testing is the one thing that we're going to be able to say, this person is suspected maybe to have it, this person does have it, and this person doesn't. And that's how we can stratify a little bit better where to place everyone. So again, we're not exposing more people to the coronavirus than need be. Yeah. So the changes that we're seeing prenatally, antenatally, and then through the delivery process.
Yeah, testing is so important. I mean, I think
so important.
We're all obsessing about the testing right now, for sure. Kimberly, thanks, Jessica. Kimberly, I'd like to ask you, you're doing so much as a nurse, as a perinatal and neonatal outreach coordinator. You're talking to families every day. You're talking to women every day. What are some of the questions that women are posing to you right now as they're thinking about becoming pregnant? Are they afraid? How are they wanting to manage it? What are some of the issues that are coming up for you from them?
So from a lot of our conversations that I've had so far, it's really been around, is it okay to get pregnant now? Or if I'm already pregnant, how do I manage this pregnancy? Will I be able to have individuals come in with me? How do I manage if I don't have a doula with me? Or how do I change those plans? And how am I able to actually go through that process? And also considering contraceptive care, and how do I access contraception at this time? Is it okay to go to get my contraception, or to talk about methods, or even to stop my methods of birth control? And just kind of going through that process. And then postpartum, I've had so many FaceTime, face chats with lactation questions that they may have actually gone into the office to have done, or even just having those conversations about grieving the loss of being pregnant, going out and being able to say, oh, you're pregnant, congratulations. Well, now we're quarantined and you don't get to do that. So how do I support my mental health? And how am I able to go through this process? And how am I able to actually kind of build my community on a virtual platform, where I would have either my mom or family and friends come over to be there with me when I can't do that now. So what are the methods that I can put into place to kind of have that support?
So if a woman says, I just don't think this is the right time for me right now. I think it's too stressful. I don't think I can handle it right now. What are you advising women in terms of the best form of birth control during the pandemic that could go on indefinitely? We don't know how long it'll go on. I mean, what kind of family planning advice and contraception advice are you providing to women?
So one thing we want to make sure is that the device or whatever method that they're using is best for them. So making sure that they're able to choose and that they have the choice of whether they want to stop it or how long they want to be on it. Bedsider.org is a platform that has lots of different types of choices. So you can go on and see what's best for you. So we try not to say this pill is best for you or a device is best for you, but go on and actually see what method is most effective for your lifestyle.
And what's the name of the website again?
Bedsider.org.
Bedsider.org. Okay, we'll make sure someone puts that in the chat box too, or in the comment section. Okay, we'll come back to you, Kimberly. Thank you. And Kelsey, thanks for being with us today. You're here as a mom, and you have been incredible in sharing your story. And I think a lot of women would love to hear more about your story because I think it's really important during this time. So tell us a little bit about your story of pregnancy.
Sure. So my first pregnancy was a couple years ago and unfortunately resulted in a preterm delivery at 28 weeks due to HELLP syndrome. And I had a son in the NICU for just about 3 months before he was discharged, and he's gone on to do wonderfully, which we're so grateful for. After that pregnancy, I sought the advice of a maternal fetal medicine doctor about whether or not I was responsible to get pregnant again. We determined, given the risk factors, that if we wanted to grow our family, that was safe to do so. But unfortunately, my second pregnancy also resulted in HELLP syndrome, along with some other complications, IUGR, and some issues with the placenta as well. And that baby was born, my son Leo was born at 25 weeks and lived for about a month before passing away due to complications from his prematurity. So it's interesting for me as an advocate of March of Dimes, I've been on the side of dealing with maternal health complications, having a son go through the NICU and thrive, and then also having a son go through that NICU experience and not make it. And as a result of those two pregnancies and us still wanting to grow our family, we were fortunate enough to have a family member offer to carry a child for us through the gestational surrogacy process. So gestational surrogacy meaning that the baby is my egg and my husband's sperm and genetically tied to us, but carried by another woman. And that woman was my sister-in-law, who carried our 3-year-old daughter, Nora, without only one complication. We had cholestasis at the end, but far less complicated than my other pregnancies. And then most recently, we had a remaining embryo, and a friend of my sister-in-law had offered to carry for us last summer. And we went through that process of transferring the embryo, and we were lucky enough for her to become pregnant. And we just delivered our daughter, Penny, about a month ago. So my situation is unique also in that I have just been through this delivery process. It was, about 3 weeks into the pandemic. So we went through those tough questions of who will and won't be in the delivery room, which is extra complicated when you're working with a gestational surrogate pregnancy, because you want your carrier to have her partner there to support her. And then obviously my husband and I hope to be there as well. So, but we're so grateful everyone's healthy and here, and that we kind of survived this whole having a baby in the middle of a pandemic.
Well, that must have been really stressful. Who was able to be in the delivery at the time, right in the middle of the pandemic? How did you work with the hospital on that, or were you on FaceTime at least, or how did that work?
Yeah, it was. So the hospital we were delivering at, their policy was whoever is delivering and one support person. So it's been so important for my carrier and I to have really good, comfortable relationship, which we have, it feels like family. But together we decided that she would be there, and she selected me to be the support person.
Oh, good.
I acknowledge is tough because, we never expected Megan as our carrier to go through this process without the support of her spouse. And for all of her other pregnancies, her spouse has been there. So I was so grateful and so happy to be there. And I have to say, it was actually really amazing when we did deliver the baby. Megan birthed the baby, I caught the baby, and we had a female doctor and a female nurse, and it was like the ultimate girls' night out. It was this room all these strong, capable, wonderful women doing something that felt hard in a really uncertain time. And it was just a beautiful experience.
And were you all tested when you got to the hospital too?
We were not tested, we were screened. So we were screened, temperature check, series of questions, masks, gloves, things like that. But no, we weren't provided the option for a test.
Interesting. Well, it looks like everything turned out wonderfully. So congratulations, and we're so happy for you and your family. And it's so nice that you were able to be there. That was quite a blessing. Yeah.
It was so great. It was wonderful.
Yeah. That was tough navigating through the pandemic. And
it was. And I do want to say that for women that maybe have a birth upcoming, I think my experience has been that doctors, nurses, hospital staff are even being more welcoming, warmer, recognizing that women are maybe not having the experience they thought. My experience was that everyone just went above and beyond to make us feel comfortable. And so I hope that women would encounter that if they're anticipating a birth in the coming weeks.
We're so grateful to all the hospitals and the health workers and the nurses and the doctors right now. I mean, they really, I mean, we can't say it enough. They're all our heroes right now. Thank you. Thanks, Kelsey. We'll come back to you in a sec. And Tanya, you have been such a huge advocate with such a big platform for healthy mothers, for healthy babies, especially moms and babies of color as well. And of course, we've been seeing so much written about how the pandemic is impacting communities of color disproportionately. We're all concerned about what impact this will have on moms, especially through their pregnancy, especially when we're already facing issues of maternal death that are disproportionately higher in communities of color, infant mortality outcomes that are worse in communities of color as well. How do you think about, and if you're talking to a woman of color, a mom of color, pregnant woman, or a woman who's thinking about becoming pregnant right now, especially a woman of color, what would you say to her right now? And how would you help her think through that? And what would you want her to know and others to know about how we better protect communities of color during this pandemic, especially moms and babies?
Yeah, thank you so much, Stacy, and everybody for your wonderful comments. And Kelsey, congratulations. And I love that image of all of those women in there as your carriers delivering. That's how it should be, in my opinion. You know, when it comes to Black women in America giving birth in general, and right now, what I would say is first and foremost, get your body ready. You know, really think about your preconception health first and foremost. Think about getting what I call Army fit, meaning, you know, giving birth is a marathon and you need to be physically ready for it as much as you can be. So that means exercising, eating well. And when I say eating well, I mean eating real food, staying away from highly processed foods, fast foods, things like that. It means getting your rest, taking care of your mental well-being, keeping good energy around you. Really taking care of your mental and physical well-being is key at first. And then I would say, think about what you feel you will need once you do get pregnant and you go through, hopefully you get a great doctor. I would say, think about what kind of support you may need. Think about whether you certainly, hopefully you have a partner who is there supporting you, but there are doulas, there are midwives who can work with doctors as you go towards giving birth. And I would say, think about what your birthing options are. Look, I think OBGYNs are great, hospitals are great, but there are other options out there. And I'm not saying you shouldn't have an OB-GYN, because I am a believer in having the doctor, but I think that you can also deliver with a midwife. I think doulas are great advocates. I think it's really hard, you know, when you're in such a vulnerable position to be able to advocate for yourself. Even sometimes it's hard for your partner to advocate for you. So having a doula there who can be your advocate during that time can be really helpful. So that's something I think people should explore and look to. And then finally, I would say, you know, and I've been having this conversation with lots of stakeholders in the birthing area about thinking about where and how you give birth. You can give birth at a hospital. There are birthing centers. There's home. But think about what really works for you. Explore it. Think about it really carefully, and then figure out what the birthing plan is that's best for you, and also plan for contingencies in case that doesn't work out the way you want it.
And I think so much of that is so important. You know, there's a resource that we have at the March of Dimes, a birth plan resource and document that I'm sure we can put in the comments, because it is important to prepare. I mean, a lot of our conversation is really preparing for pregnancy. And we know right now, you know, about half of all the pregnancies are really unplanned or unexpected. And what we're saying right now is, if there were a better time, I don't think there's a better time to plan than now, especially for bringing a new life into the world. And Jessica, I just want to come to you and talk about that a little bit, because what should be going into the planning right now? I mean, a woman that is thinking about getting pregnant, what's the decision tree? Yes, I will. Yes, no, I won't. I mean, how are you talking to women who are saying, you know what, I was just planning to get pregnant. I really want to move forward with it. What are you telling women on the front end who are just thinking about those first steps, about what she needs to be thinking about, especially given that her pregnancy is likely to be going on and maybe even delivering the child still when we're in the midst of a pandemic?
Yeah, you know, I think that from everyone that's spoken, I love this this panel. It's so diverse, and it shows different highlights from different areas. But one of the things that I think is important is taking that step back, just like Tanya was saying, is, you know, this is a marathon, and yes, we all want that outcome of having a healthy baby. Just like you said, this campaign is Healthy Woman, Healthy Mom, Healthy Baby, is what can I do in my best interest to make sure that that could be my outcome? And so, you know, from everyone who's spoken is, one, taking a step back, saying, one, am I ready for this? Not only physically, but emotionally, mentally, and also looking at the possibility of, do I have any medical conditions that might make this more difficult? The other thing is, if I've had children in the past, were there complications in those pregnancies that again may return when we think of gestational diabetes, or if we think of preterm delivery and things like preeclampsia and severe preeclampsia, taking that into account. And also making sure that you have the support. Support is one of the biggest things that we want patients to have throughout their entire pregnancy, but also after. And thinking of the fourth trimester, and I'm sure Kimberly can relate to this, that's actually one of the most important times of a pregnancy, but often overlooked when you look in regards of mom and baby. So there's so many different things, but if I were to come up with a quick checklist, would say, one, am me and or my partner, if there's a partner involved, ready? Two, medically, what can my body take? You know, pregnancy is a beat up on the mom. It's a beat up on their organ systems. You know, Kelsey was talking about how she went through her issues during her pregnancy's HELLP syndrome. That is a big beat up on her body. I'm sure she can attest to that. But making sure that you're ready for that as you go through the pregnancy. And then also, now that we're in COVID, is really looking at that outcome and how it's changed. Because, you know, it's here to stay. You know, COVID will always be around because it's coronavirus. It's a virus just like we have flu virus and how we had polio, all of those different viruses, they're still here. But how are we going to make that transition? And everyone's transition has been very different through this time. And I hope that people can really sit back and look at that, because although we're all going through it, we're all going through it together. We're not all going through it together the same way.
Right.
That's what, you know, some of the things that we will see. You know, Tanya was talking about maternal mortality and how that's increased in, you know, a Black woman is 3 more times likely to die in childbirth or have some type of complication after childbirth. So these are the things that you're actually seeing magnified during this time in COVID, because of when you have systemic racism and also those things that occur within the system that's being magnified now. So I think that, one, there's a lot to take in, but two, you can actually go through those very systematically and figure out where you fall into those categories to come up with the answer that's best for you. But I think once we take that step back and look at it kind of like in different categories and say, where do I fall in this category with past medical history? Where do I fall in this category as far as, am I ready personally for this? And then also now that we're in this COVID stage, how would that affect you? I mean, it affects people differently.
Very differently. And, you know, Tanya, you did speak about that. And I'd love for any one of y'all to chime in. I'll start with Tanya and then anybody can chime in on this. You know, we talk a lot about physical health, but I think everyone sort of mentioned at some level the issue of mental health. And there are a lot of women right now who are not only facing the stress of what is it like to deliver, to have a baby, to be pregnant, to deliver a baby in the midst of a pandemic, but on top of that, they may be facing job loss, or a partner may have job loss. I mean, they might be facing extraordinary stress, but then the greatest dream in their lives might have been to be able to become pregnant, right? You know, during this time. That may have been the thing in 2020. They thought that now this is my year. But the stress of the chronic stress that that a lot of women, a lot of people are experiencing right now is sometimes can be overwhelming. And how important is that as a factor in thinking about whether or not this is a good time to become pregnant? I'll start with you, Tanya, and then anyone can chime in.
Well, stress is huge and it's real. I think first and foremost, I would say that you shouldn't bat it away as saying, you know, it's not a big deal, I can handle it. Stress is real. Stress has real physiological implications on your body. And so you have to deal with that. And I would say that you have to try to think about ways to relieve that stress. And what I mean by that is, you know, maybe your plan was to have a baby in 2020 and you really want to do it, but our world has been rocked. So maybe the idea might be to not add more stress, but think about ways in which you can alleviate stress, get things balanced so that you are ready maybe later to have a baby. Maybe it's about just figuring out, I mean, as you talk about, there's so much job loss. People are really struggling out here. And I think we have to figure out how we are just as human beings getting our grounding. I mean, you know, I'm in a very fortunate situation, but I know before 2 weeks ago, it was really hard for me to just function, just to show up to work.
Yeah.
And that's in a really good situation, right? So you have to give yourself a break. You have to realize that stress is real and try to figure out a way to get the ground under your feet before you can really embark upon having a child, because that will certainly add to your stress for sure.
Yeah, I think it's really important to consider the stress aspect, especially when you're considering the actual labor part of pregnancy. And we know that stress, the catecholamines that release and all that actually impacts your pain management and what happens during your delivery process. So finding methods to actually be able to manage those is really important. I also wanted to add as you're considering preconception, Show Your Love Today is actually a platform and a website that has lots of preconception conversations and things to think about when you're considering getting pregnant again or for the first time. And it kind of takes you through an algorithm of what should I consider, and it has evidence-based information there.
That's awesome. That's awesome. Kelsey.
One thing that was really helpful for me is after I lost my second son and I was entering that third pregnancy, I was having a really difficult time managing stress. And obviously we weren't in the middle of a pandemic, but stress was something I was having a really tough time with. And at the advice of my OBGYN, I actually, through my insurance plan, found a therapist that could do teletherapy because anyways, that's what I preferred. But I started working with a therapist weekly for the second and third trimester of that third pregnancy. And the difference was night and day as far as managing stress. And granted, it was different because it was a gestational surrogate situation, but still, that's something maybe I would consider if you happen to be pregnant now and you're having a hard time coming up with ways to cope with the stress, maybe inquire with your OBGYN or maybe, through other methods. Like I said, I found someone through my insurance plan so that it wasn't an extra financial burden. But having that weekly call really helped me manage my stress and develop those strategies to get through that pregnancy.
That's so important right now. And I think the ability to do therapy sessions,
Yeah.
I think is a godsend for so many people.
And the reason why actually, and that's what I was, when I was alluding to telehealth, how it's really revolutionized access and resources for people. If you think of a new mom struggling to sleep, to keep up with pumping and breastfeeding, taking care of maybe other kids and siblings in the house, can you imagine, one, that's adding to her stress, but two, how am I going to now leave this and go to a therapist and get everything that I need in order to set myself straight? So I reach out to a lot of therapists, and a lot of therapists have actually been very vocal with saying we now offer telehealth visits for their clients. But I think this right here is phenomenal. I did see an article, and I cannot remember where I saw it from. It was in the last week, that's saying just even looking over the last few months, 3 months of maybe what we would consider COVID in the US, that they have seen an increase in the amount of depression, anxiety, postpartum depression. So it'll be astonishing to see after we've kind of gone through this peak and gotten to a more normal level, what those numbers really look like in a research and statistical way, because I think that we're going to be surprisingly seeing more of a mental health issue for people who are thinking of pregnancy, are pregnant, struggling with infertility, and the general population.
So on that point, I'm just checking my phone because there's news hot off the press this afternoon. I think the CDC has released new data this afternoon saying that 13% of women reported symptoms of depression after giving birth. And of course, this is coming, but I think this is not even taking the full impact of the pandemic, I suspect, into account. That 1 in 5 women reported a healthcare provider did not ask them about depression during prenatal visits, and that 1 in 8 reported that a healthcare provider did not ask them during a postpartum visit. So we have a lot.
I believe that.
I know, and so that's straight from the CDC. So I think, these issues of mental health and depression, we have so minimized in this country. And I think it is time, especially as it relates to pregnant women and mothers and the impact it has on our babies, that we have open and honest conversations about what it looks like, how we get help, the symptoms, how we know we're having problems, and really encourage women, if anybody is feeling like they need that kind of help. And of course, we already did a session, and we're going to be doing more of these webinars around maternal mental health. But it is really critical. As important as it is to focus on your physical health, your mental health is also important as well.
Yeah.
And there's no shame. There is no shame in that.
Shame at all.
Absolutely.
And, just trying to get yourself some help is the key.
Absolutely.
And this is May, it's Mental Health Month. So it's like that we could talk about this. But one of the things I realized is these uncomfortable conversations that people think mental health is, and allowing them the freedom to express that, is the more we talk about it, the less uncomfortable it will be. And so I think that's where we can get with these conversations here on March of Dimes. I know Tanya's a big proponent of mental health and making sure that we address those in those ways. So kudos to everybody.
Yeah, and some resources for maternal mental health. You can go to Postpartum Support International. They are hosting sessions to help that are virtual, and there's lots of other opportunities out there. Also on newmomhealth.com, we also have resources for postpartum depression and just mental health checks, making sure that you're able to check and see and that what's happening, and you're able to get that help and connect with others is important.
And I know we're putting up some resources at the March Dimes. We have a lot of thank you for that, Kim. That was wonderful. And then we also had the Maternal Mental Health Leadership Alliance, and Adrienne Griffin, who is the head of it, was on one of our webinars. So they are a great resource as well. We did have a question on Facebook, and it comes up a lot. So we keep going back to it to make sure everyone gets the right information. And Kimberly or Jessica, any one of you all can answer this. Should moms breastfeed during this time? And especially if the mom has COVID-19?
Yeah, so I know that WHO actually they do have a recommendation for breastfeeding. It is breastfeeding. With breastfeeding, you are able to pass on those great antibodies for your baby. So breastfeeding is okay. You want to make sure that you follow the same standards, wash your hands. If you are COVID positive, that you wear a mask when you actually have that connection with the baby, and that you do continue that. So we are definitely recommending that we continue that process.
That's great.
And just like Kimberly said, we definitely want to make sure that we're encouraging that and people not shying away from the bonding that you can get from breastfeeding, but also the extra nutrients. But this is also a wonderful way to have caregivers give support. So if you have a COVID positive mom, and sometimes there's a little bit more heightened anxiety of, passing it on to a newborn, is allowing her to pump and then allowing someone else to help feed the baby. That's a great way to create an atmosphere in the home where other people are helping and other people are taking part in how to take care of a newborn and making sure that they get the nourishment that they need while still helping mom and decreasing that anxiety if she's COVID positive.
Yeah, you bring up a good point. When you consider if it's a COVID positive mom, you also want to make sure that she's taking care of herself too. So thinking about that whole fourth trimester piece of it, you want to make sure that mom is getting plenty of rest, that she's delegating out and actually asking for help, and being able to kind of reduce the amount of work that she would do. So if there's another baby that's around or another child that she's trying to manage both of them, how can she get that support? And think about one thing, if you're pregnant now, you could also think about, what if I do get COVID and I do become positive? Kind of have that plan in mind of who can I ask to help me, and that can be connected to me at this time, because they're going to have to be there for a while.
Well, Kimberly, that sounds like good advice for non-COVID positive moms too, right? Like making sure you're getting your help and your support throughout as well.
Yes. You're right, and kind of making that postpartum plan and being able to balance that out. We have a plan online that it kind of guides you to talk about, how do I build my community, and how do I build, and how am I okay to ask for help and not do it by yourself, and work through that process, whether you have COVID positive or you're just having a new baby. That transition is huge, and being able to make that connection is really important.
So I want to touch on a couple questions.
Oh, just one more thing. I wanted to make one more plug on the whole breastfeeding issue, because I really adore breastfeeding. It's hard, but I love it, is donor milk. There are so many moms out there, even pre-COVID time, who weren't maybe able to produce enough or had an issue where they weren't able to have that bond with their child, but using donor milk supplies is another wonderful way to still get that milk. And if there's any stress due to supply or because of the bonding, but donor milk is great.
And I have heard some women ask, is donor milk safe now with COVID-19? How are women to be sure that it's safe to give the baby?
Well, the donor milk, I mean, they are very regimented. Just if you think of like a blood bank and how, they clean the blood and make sure that it's free of any viruses. So I definitely know that breast milk banks do a wonderful job at making sure that there's no transmission of any diseases. But because we know that COVID is mainly a respiratory virus and that's how it's transmitted, I don't think, and I don't know for sure if they're using ways to test for that. But because of the way it's transmitted, the likelihood of it getting into breast milk, donor breast milk, is low. And we haven't even seen that for COVID positive moms who have it, transmitting it to their baby that way either. So
exactly. I think there's no evidence right now that even COVID-19 shows up in amniotic fluid or breast milk. So that's a good thing. So breastfeeding is generally safe as long as you follow the precautions of mask wearing and hand washing and all of that. Another issue, I was going to go to contraception, but I'm going to do that in just a sec. I really want to touch on something else. We're talking about nutrition for the baby. I really want to talk about nutrition for the mom because, Tanya, you started down this path a little bit, and Kelsey, this is kind of what you do in some ways. Kelsey, why don't you talk a little bit about, and Tanya, maybe chime in about, what are some of the nutrition things as a woman is thinking about becoming pregnant? And she's trying to boost her immune system. She's trying to stay as healthy as possible. She's got to make sure their body is ready for pregnancy. Talk to us about what are some of the nutritional things that women ought to be considering during this time as well.
Well, it's a great question, and something that I also thought a lot about with my second pregnancy. Really, you want to be in the best health you can be in before you become pregnant. And that's going to reduce, for me, it was even reducing the anxiety of, what if some of the issues I was having was tied to my health and diet. But as far as that goes, I think something Tanya had mentioned earlier is really trying to stick to whole foods, trying to stick to things that aren't processed. I know it can be really tricky right now when we're opening up the doors of our pantry and we're seeing those boxed dinners and those canned soups and things like that. But when available and when accessible, to try and have balanced meals that have fresh fruits and fresh vegetables and lean proteins. I think another thing that comes to mind is for mothers that maybe want to get pregnant or were planning to get pregnant in 2020, but now maybe you're second guessing it because of the stress element. I found that as I was trying to grow my family, I always wanted to be doing something proactive to grow my family. So maybe if that's not moving forward with getting pregnant right now, focusing on your health and to be as healthy as possible so that maybe when the time does feel right and you can handle it, you know that you're in the best health possible. So that's something that I think that we can always be working on, especially when we're getting ready to welcome our pregnancy or babies.
Really
yeah, I think that's great advice, Kelsey. The one thing I would add to that is I think folate is really important. I mean, you can start taking folate on a regular basis, which helps the baby develop and keeps cystic fibrosis away. And, as someone who is into supplements, I would say, keep those B's going that make you feel good. In terms of immunity boosting, vitamin C, just really trying to make sure that you're getting the baseline nutrition that your body needs to function at its best. I don't think I can say it better than Kelsey did just then, but that's essentially what it is.
That's great. And I want to just talk a little bit about going back to this issue of contraception because, in order to properly plan, women need access to the right kinds of family planning tools and information and contraception that they think that is best for them. And Kim, you talked a little bit about that, but give us a little bit more detail. If a woman's thinking about different types of birth control, if she's thinking, well, am I supposed to time my birth or expected pregnancy along with when the pandemic's going to end, but when's that going to be? I mean, I can't imagine how a woman should be thinking about that in terms of, should it be on long-acting reversible contraceptives or should I be on some other kinds of contraception? So how are you coaching or advising women about some of these challenges and questions?
So I think, like I mentioned earlier, going back and considering what you want to do for your life or when you think you might be ready to be pregnant. If you think that you don't want to get pregnant in the next 2 or 3 years, like no matter if it's a pandemic or in the next 5 years, I'm good, you might consider using a long-acting device because you have a longer period of time. But if you're not quite sure, maybe I don't want to get pregnant right now in May and I might want to start again in September or October, you might consider another a shorter acting device or like a pill or a ring or insertion. It really depends on what you want to do for your life and how you want to have it, how the actions, and really also considering if you want hormones or not hormones. There's a lot of different types of devices and pills that you can use.
I just want to add something in here because when my children are old now, but no one told me, back when I was almost pregnant, that going off of the birth control pill, I thought if I went off the birth control pill, I needed to give my body time to adjust before I could get pregnant. But I went off the pill and I got pregnant the next month. So I'm just giving everyone a heads up out there. You can get pregnant as soon as you go off that pill, just heads up.
Wow, yes, that's Kimberly.
It worked out wonderfully for me.
It worked out great for you. Kimberly, that's true, right? I mean, Jessica, that can happen.
Yeah, as soon as you stop, depending on what type you use, as soon as you stop, you definitely become pregnant because your body starts to transition again, and that whole process begins again. So you can get pregnant whenever you're ready. So that's why it's important to think about the type of method that you want to use and how long you want to actually prevent the pregnancy for.
So one of the things that women have, and Kelsey, you were touching on this in terms of limitations in the hospital, and that's what a lot of women are hearing right now is, I want to be pregnant, but I don't know what it's like in the hospital. I don't know if I want to go to a hospital. I think I'd rather consider a home birth. Is that possible? How do I even know how to do that? Who do I go to talk to about that? I'm going to just throw this open to whoever wants to answer, but there certainly are a lot of women. I'm hearing that there are an increased number of home births that women are considering or pursuing. What are the things that women ought to think about if that's the path that a woman would like to take?
Well, I can speak to this just because I just went through this experience where when we were in our 38th week of pregnancy is right when things started to shut down with COVID and things really started to ramp up. And we had initially planned on a hospital birth, given our previous experience of needing the NICU and needing care for me from a maternal standpoint. But our carrier had had 3 successful home births, and that was her preference for birthing. And so we, when we realized at the very beginning of the pandemic, the hospital we were working with was talking about having no visitors, and that would have been our carrier delivering on her own. And then even if it was just one visitor, her and her husband, but then the nurseries in many of the hospitals are closed. So I had anxiety about where would the baby would go. She was our carrier, but she wasn't prepared to mother the baby, and that's not what she signed up for. And so the thought of me having to meet my baby in the parking lot of the hospital was just so devastating to me that we did meet with her midwife who had delivered her other babies at home. And we actually did 4 times switch to a birth plan of birthing at home. And, for a variety of reasons, but ultimately intuition and gut instinct, my carrier and I, after her going a week past due, right at 41 weeks, we decided that we felt like we should return to the hospital. And at that point, she'd felt like she could labor without her husband there, and I could be there to support her. But we went through this whole situation of trying to find a birth center that would take us, that maybe meet in the middle. But I'll tell you from experience, birthing centers tend to be quite popular. So if you think a birthing center is something that you might want to consider, given that you might be delivering in the middle of this pandemic, better sooner than later to inquire with those birthing centers and make sure that the provider you choose will deliver at a birth center. So thinking about those birth plans are really, really important. I do think you can have a really successful home birth, but I think it's very important to evaluate the mom and her previous pregnancies and her any existing conditions she may have. Because I will say that we went to the hospital and my carrier Megan did experience a pretty significant postpartum hemorrhage, and it's a good thing we were at the hospital. So it's just really important to provide a thorough risk assessment and realize what risks maybe you're risking by not being in a hospital or a birthing center, but it's never too early to start thinking about the options that you want to make available to yourself.
I think giving yourself enough time to really think through those options and decide on a plan. Jessica, did you want to add to that as well? Because I'm sure you're getting hit with these questions too.
Yeah, no, I've heard a lot of change as far as people wanting to shift their place of delivery. The only caution that I would say is at the timing of when you would want to switch. So the other way that Kelsey was saying, so people who were initially going to deliver in a hospital and then switching to a home birth, there's nothing wrong with home births. I just want to make sure that people know that they're the correct. It's also about patient selection, right? Who's going to be that person who's going to have, again, that healthy outcome that we're looking for. So having those conversations to make sure that they don't have, high risk factors that might cause a problem, with a delivery away from medical services. But no, I think that people should look into home births and who is available in the case of an emergency, the proximity of the birthing center to a hospital, again, maybe who's the supervising medical director of the birthing center, or making sure if you have a home birth that there's like an actual plan in the case of events. Because deliveries, most of them go fine, right? But it's those ones that don't. What are the steps and what is the urgency in order to get that taken care of? That's really where, that urgency comes, is having the appropriate people around and also access to the things that can thwart any emergency that's going to occur.
So
one thing that we had done with when we made a switch to home birth is we made our midwife in contact with the OBGYN. So it was a whole team of people working together, so that when Megan and I, my carrier and I, decided that we wanted to return to the hospital, everyone was in the loop. So I think it's really important to make sure that there, should you need access to an OBGYN, you've got someone that you know you're going to turn to, and so forth. That was really helpful for us.
Really
Yeah,
smart.
I think it's important to actually think about it at the beginning. So now if you're planning on getting pregnant or considering what your options are being and you're making your birth plan, go ahead and think if you're considering to have a home birth, and start it from the beginning so you can have this risk appropriate care the whole time. So you can have that conversation about any chronic illnesses that you may have that need to be managed that may not be able to be suited at a birth center, or what you need to do in order to have that process effective and smooth. So kind of bringing the whole team together at the beginning so that you kind of can manage and maneuver through the whole process.
It does take a village, right? It takes a
And I
village.
would definitely piggyback on what Kelsey said, is that everyone is in the loop, because from our perspective, we always see the worst of everything, right? And so a lot of times what we see from home births or birthing centers are the people we never knew about their care, and then they show up in an emergency, and that's when we see that tragedy. So of course we see a different side of it, but if we know everything that's going on, like Kelsey said, then we're good to go. Yeah.
Well, I wish we had a whole nother hour to keep going, because this is a fantastic conversation. And I just want to say thank you all for being here and sharing all your insights, sharing your knowledge, and certainly making sure that a lot of information gets out to a lot of women that need it. Thank you to all of our panelists for joining us this afternoon, and certainly to all of our viewers on Facebook for being here. And hopefully you benefited from some very important, very relevant information. Just a couple of things before we end. There are some additional resources. Kim gave a chock full of websites and places to go. Here's some other ones, some that you mentioned, Kim, and then others as well. If you want more information, here's some websites to go to around preconception health. The Fourth Trimester Project has a lot of information around what to do postpartum. COVID-19 health information is available at the March of Dimes, including a whole chock full of tons of information at the March of Dimes around getting ready to be a mom, all these issues of planning ahead, preconception checkups. And I know all of our panelists have amazing resources and are always available and are always sharing every day incredible information. We have one other thing we want to add too, which is this often can be a time when women don't necessarily feel completely safe. You may be quarantined or maybe isolating with someone in the household, and it may not be as safe a situation as would be preferable. And if anyone's listening to this and needs additional help to avoid any kinds of issues around domestic violence or intimate partner violence, we certainly want to make sure there's a resource available that you all know about where you can safely reach out for help. That's always really important. The last thing I want to mention, again, I just want to thank Merck and Merck for Moms again for the generous support. And we are going to be having this webinar again every week. The next one is going to be on maternal warning signs, when to see your provider during COVID-19. So we are excited about that. We'll have some other great panelists with us. And again, we are also, in addition to some of our corporate support, we are really able to bring all of this kind of resource to all of you all because of such generous support from so many of our donors. We've celebrated Mother's Day, although every day is Mother's Day. If you listen to a lot of us, including Jessica Alba, who just participated with us on It Starts With Mom. But we're also looking forward to Father's Day, and we just launched a new fundraising effort between now and Father's Day to generate some more resources for us. So if you want to be a part of that, please feel free to go to marchofdimes.org and to our Facebook page, especially, and get involved with that. It'll be an exciting time. And we always celebrate the moms, but we do need to recognize the dads as well. We're going to be hoping to raise almost over $10,000. That's $1 for every baby that will be born each day between now and Father's Day. So please be, if you're willing to support us on that, we'd love to have it. Last thing, tomorrow, big celebration of March for Babies, our recognition day. We virtualize all of our March for Babies events, and our big celebration day is tomorrow. It's from 2 to 3 Eastern time. It's going to be at our March Times Facebook page. We're going to have tons of exciting things, lots of great storytelling, lots of great celebrations of families who've been impacted by the work that we do at the March of Dimes every single day. So feel free to join us tomorrow between 2 and 3 as well. So thank you again to our panelists for being so wonderful. It's so great to see you all. Thanks for being a part of today. And we look forward to seeing a lot of you all next week. Thank you.